Okay, so good evening, everyone. Today we are going to learn about the basic principles of ultrasound. I'll be explaining how the ultrasound image is formed and what are the basic concept and what are the basic terms that we are using in ultrasound. Okay, so we often come across a common question that is asked by the patients, by the even by the medicos, by the non-medicos, that whether ultrasound is harmful for the child, for the adult, or it is emitting any harmful radiations or not. So the answer is no, it is not emitting any harmful radiations. Why? Because it is using sound energy. So sound energy which is above the audible range. That is why we don't hear those sounds. So, what is the our audible range? That is below 20 kilohertz, but ultrasound refers to the sound above the audible range, that is above 20 kilohertz, right? So, why do we prefer ultrasound over other modalities? Like, why not CT, why not MRI, or why not X-rays? So, first of all, we have already discussed that it is providing, giving us the radiation protection. Then, the second thing, that is, it is non-invasive. We are not using any contrast agents. We are not using any needles so as to scare the child. Then secondly, it is providing a high resolution image, right? So although we are getting a high resolution image from the CT and MRI as well, but the real time imaging that that is provided by the ultrasound is unimaginable. So we're getting the bowel movements, the diaphragm movements, movement of the different structures, movement of even the gallstones are mobile or not. We are getting that information from the ultrasound. So we often come across different probes. So by changing the transducers, they're known as the transducers and the probes. So by changing the transducer, that will change the frequency. Every probe has different frequency, and by using those frequencies, we will analyze that what is the use of that probe. So first of all, the phased array probe. They're used as a high penetration probes, and they're used in the intercostal imaging, in cardiac imaging, and then the linear probes, which are used for the superficial scanning, about the bowel scanning, about the for the scanning of the thyroid, the superficial structures, breast ultrasounds. So then the curvilinear probe, which is the most usable probe in ultrasound. So that is used for the abdominal scans, basically for the pelvis, for the abdomens. And then the endocavitatory probe, which is very rarely used in children, but we often, it's actually a transvaginal probe, which is not used transvaginally in children, but it can be used as a for the cranial ultrasounds in neonates, and also for the transperineal scans in females, right? So, studying about what the transducer is composed of. So, first of all, the first layer is the matching layer. So, that is the foremost layer of the probe of the ultrasound. So, it has a property of minimizing the acoustic impedance. So, this layer in the front, the gray layer, is the matching layer. So, that provides an interface between the transducer and the tissue, right? So, we do not want the sound to be reflected before it enters the human body. So that is the use of matching layer. So the thickness of the matching layer is equal to 1/4 of the wavelength. So that is why it is called as quarter wave matching. Then the next layer is the piezoelectric element. So it is the active element of the transducer, the piezoelectric crystals, which is composed of the ceramic material, that is the lead zirconate titanate. So the purpose of piezoelectric crystal is to convert the electrical energy into sound energy, right? And this every probe having the different frequency. So how is that possible? That is possible because the piezoelectric crystals are of specific size and thickness in each probe. So that is providing a desired frequency to that probe. Then the next layer is the backing material, which is providing the alternating current, which sits on the back of the transducer. And this is composed of the epoxy resin, which is loaded with the tungsten, and that provide the dampening effect to the piezoelectric element, so that it is easier for the piezoelectric element to convert the electrical energy into sound energy. Then comes the housing. So all these components, they are housed, they are composed inside the plastic material, which is the housing, which is tapered in a form that it can be easily maneuvered, so that the user can easily hold the probe properly. And then the cable and the connector. So that is the most important thing, because that is connecting the electrical source, the external source, to the transducer. So by which the transmitter is activated, by which is activating the transducer. So that is a secure, there's a secure connection between the transducer and the ultrasound machine, which is provided by the cable. So coming to the piezoelectric effect, so piezoelectric effect is all based on piezoelectric crystals. It is actually, if we look in the simple language, piezoelectric effect is the vibration of the piezoelectric crystals. So the piezoelectric crystals, when they get activated, they emit the sound waves, and these sound waves hit the organ, which is reflected back by the organ into the ultrasound waves are back hit it back into the ultrasound probe, and that creates an image on the screen. So just initiating the process, first of all, a high amplitude voltage pulse is applied. That is by the external source, which is taken into the cable, and which is a secure connection between the transducer and the ultrasound machine. And then the transmitter activate the transducer. So when the transducer is activated, these piezoelectric elements, they vibrate when the alternating current is applied, and that generates the sound wave. So sound energy is a form of mechanical energy, and it travels through the body in the form of a wave with alternating compression and rarefactions in the conducting medium. So before we initiate into the basic concept about the impedance, about the reflection, refractions, we should know what the wavelength and frequency means. So wavelength is the length or the distance of a single cycle of a wave, and frequency is the number of sound wave cycles per second, right? So we can memorize this formula, that is frequency is equal to velocity divided by the wavelength, so that we know that frequency is always inversely proportional to the wavelength. So as we decrease the wavelength, we decrease the distance, it will increase the frequency. So shorter the wavelength, higher the frequency, and longer the wavelength, lower the frequency. Now, why do we need to learn about all these things? Because we know that higher frequency probe, they provide better resolution. Now, why do they provide a better resolution? Because higher frequency probe are using a very shorter wavelength. So they are traveling a very less distance, right? But because they're providing a shorter wavelength, their penetration will be less. So higher frequency probe like the linear probes, why they are used only in the superficial scanning, in the thyroid, breast, ultrasounds, which are in the superficial, we want to, when we want to see the superficial structures, because they're providing a better resolution, but the penetration will be less. So we do not need those probes when we need to see the deeper structures. Okay, so then coming to the phased array probe, they have a great penetration, but the resolution is not that much. The greatest resolution is in linear probe, but the penetration will be poor. So we need to decide before we are starting the scan that which probe will be best for this ultrasound. So learning about the same thing in the schematic diagram, we can know that when we are traveling it for a shorter wavelength, shorter distance, high frequency will be there. So more number of cycles will be traveling, but in a longer wavelength, low frequency will be there and lesser number of cycles will be traveling. So we have discussed. Then in the formula, there was a term velocity. So velocity means the speed of the sound. Right, so the speed of the sound in all medium and the velocity in all medium on an average is 1540 meter per second. So depending on what medium the sound wave is traveling, that will drastically change the propagation of sound as it is passing through it. So the two of the factors that affect the speed of sound are the stiffness and the density of that material in which it is traveling. So the stiffer the medium, the faster of the sound wave. And why the sound wave will travel faster in solid? Because the molecules are densely packed, right? So that is why it will be moving faster in solid than in liquid. So we do not need to memorize the value of every speed of sound in all like lung, fat, soft tissue, but we need to just memorize this, that the average speed is 1540. So the ultrasound propagation of sound will be slowest in lung, then in the fat, then in the soft tissue, and it will be fastest in the bone, right? So coming to the most important aspect of the ultrasound physics, that is the impedance. So impedance in a simple language, it means resistance. So resistance on the ultrasound beam will be encountered as the sound wave will pass through that tissue. Okay, so as the sound wave will travel through a medium from one impedance to the other medium, which is having another impedance, there will be a change in impedance, and this change in impedance causes a reflection. So that change in impedance is always required for a reflection, because the reflection of sound wave will not occur if a medium is traveling between the two objects which are having a same impedance. Okay, so if the body has only one uniform density or a tissue is having only similar identical impedance, there will be no image formation. Why? Because there will be no reflection. So the amount of reflection is proportional to the difference in the acoustic impedance between the two medium. So the face of the ultrasound transducer, they are designed in a way with the material also that has an impedance similar to that of the epidermis. So that is why in the starting, I just explained about the matching layer. So this is what the matching layer does. It does not allow the reflection of sound wave before the sound wave enters into the human body, because the matching layer is designed in a way that has a material which has the impedance similar to that of the epidermis of the human body, so that there is no reflection before the sound wave is entering into the human body. So then we're using the ultrasound gel, we all know, which is used to prohibit the air from entering within the transmission of the signal, so that there's a better resolution. Then we know that bone and air, they are the, that they are having the largest difference in impedance. So that is why we are having the reflected A lines with the pulmonary ultrasound. So larger the difference between the impedance, that is like bone and air, almost all the ultrasound wave will reflect back. So because of that, we are having the reflected A lines. So also have a very good the formula, that is impedance is density into the speed of sound. So the impedance is decided by the density and the density of a material and the speed of the sound wave. So this is the basic flow chart by which we can understand that how the image is formed. So first of all, the electric signal will reach the cable that will activate the transducer. The transducer will allow the piezoelectric crystals to vibrate. We are using the ultrasound coupling gel to increase the resolution and emitting the air between the human body and the transducer. Then the sound wave will travel through the human body, and because of the change in impedance between the two tissue, there will be a reflection of sound wave. And after that reflection, there will be refraction of sound wave, scattering of sound wave. Some of the sound energy will be absorbed. This all is clubbed and it is called as attenuation. Attenuation is, and again, the absorption of sound wave when the sound energy is lowered. And because of these pressure changes due to the reflection, it is returned back to the transducer, which is causing the distortion of the crystals, which is again creating an electrical impulse, which helps the transducer, the ultrasound machine, to form an image. So we have already discussed about the reflection and how is it happening. It is happening because of the change in the impedance between the two tissue. So more the acoustic impedance between the two tissue, more will be the reflection. And majority of the sound wave is reflected back when the transducer is perpendicular to the structure of interest. When we want to see the liver, reflection of a liver better, we are keeping the probe perpendicular to that structure, so that more sound wave is reflected back and we are able to visualize the whole structure very clearly. So now there are two types of reflection, that is specular and the diffuse reflection. So specular reflection is the smooth and well-defined structure when they're reflecting and emitting the echoes. That is the because of the specular reflection. For example, the bladder, diaphragm, tendons, they have a sound wave which is larger than the incident sound wave. And coming to the diffuse reflection, which is irregular in shape and it is causing a reflection of the sound wave in multiple disorganized directions. So it has a sound wave which is similar to that of the incident sound wave, for example, in kidney, liver, the basic solid structures. Then what is the main benefit of this reflection property? So as we know that fluid fill structure, they allow the transmission of the sound wave. So they provide a very good acoustic window to the structure which are deeper to it. So why do we need to ask the patient that if we want to visualize the uterus and ovaries, you need to hold your bladder, we need your bladder to be full. Why? Because it provides a very good acoustic window and we are able to visualize the deeper structures better. So that is the benefit of that reflection property. But we do have a limitation also of the reflection property, that some tissue, they interfere with the transmission of sound waves. For example, the ribs and the bony structures. We cannot see because of the, when we are doing a scan and we are having the acoustic shadowing from the bones and the ribs, it is very difficult to image that structure. So and also you have seen the ultrasound reports, they have written that because of the excessive bowel gas shadows, we are not able to visualize we are not able to get the scan to be very optimal. So that is why, because the gas scatters the signal, and because of the scattering of light, we do not get the proper image. So that is why that is the only limitation of reflection property. So coming to the refraction of the sound waves, Reflection occurs when there is the difference between the impedance between the two objects is more. There's a very good change in impedance between the two medium. But when the change in impedance is a very slight, that is when the refraction will occur. Now, refraction occurs between the two tissues which are very adjacent to each other. They are having very slight difference between the impedance value, and that is why, because this there will be very slight impedance value, the speed of the speed of the light of the sound changes slightly, and because there is very slight change in the speed and the impedance value, there will be change in the direction of sound, that is called as refraction. So how much a refraction will occur, that depends on what angle the ultrasound wave is encountering the second medium and the change in the speed in the second medium. So edge artifact in a in the vessel, in any of the vessel, is an example of refraction of sound. Artifacts we will discuss in the further classes. So again, the ultrasound refraction is because of the slight difference in impedance between the two tissue, and there is a slight difference in the speed of sound. So coming to the absorption of sound, now once the sound wave is reflected or it is refracted, then it is converted into thermal energy. Now that, when it is conversion into the thermal energy, causes the loss of sound energy. So the absorption is greater in soft tissue than in fluid, and it is greater in the bone than in soft tissue. And the sound absorption is a major cause of acoustic shadowing. The more the object absorbs the sound, more it is causing acoustic shadowing. For example, the stones, renal stone, gallstones, or any bony structures, bones, ribs, they're absorbing the sound more, they're causing more acoustic shadowing. Then there is scattering of sound, which is the redirection of the sound in many directions, and scattering can also occur in solid tissue or in organ because of the result of heterogeneity. So attenuation is the clubbing of all these factors, that is absorption, reflection, refraction, and scattering. So it basically it means the loss and the absorption of the sound energy through a medium. So when the sound waves are traveling inside the and propagating into the biological tissue, there is loss of amplitude and there is loss of intensity. So the frequency of the wave and the distance of the travel, the depth which is it is traveling, as well as the angle of the ultrasound transducer, that affects the attenuation. So the high frequency signals, they have high attenuation, they have excellent resolution, but they undergo rapid attenuation. So a high frequency, again, the high frequency signals, they will have great resolution, but the penetration will be limited. And lower frequency wave, they will have less attenuation, but it can penetrate the deeper structures as well. So attenuation is the decrease in the ultrasound signal, which is more in the air, bone, or gallstones. So coming to the Doppler shift. So Doppler effect is to evaluate the movement which is either towards or away from the ultrasound probe. Now we often come across people, analyzing that the Doppler, whenever we apply the Doppler color Dopplers, the red means that it is giving color to the arteries, and blue means it is giving color to the veins, but it is not like that. Doppler is to evaluate the movement of anything. So when we are applying Doppler to any blood flow, any vessel, it means that the RBC are either moving towards the probe or they're moving away from the probe. So when they're moving towards the probe, the frequency is increasing, and that is giving a specific color, maybe red or maybe blue. And that is decided by the setting of the ultrasound machine, which is always displayed on the screen. And when the RBCs are moving away, the frequency is decreasing and it is giving a specific color. So the Doppler shift is mainly, it is related to two things, that is velocity of the blood cells and the angle of insonation. It does not mean the artery or the vein. Then there are four things, that is color Doppler, power Doppler, pulse Doppler, and continuous wave Doppler. So these are four things that we often see in the Doppler scans. So the color Doppler is the simple color mapping of the flow direction, that we want to know whether this organ is having blood flow or not, right? It allows you to see the movement of the blood in the arteries and the veins specifically, and that is giving a blue and the red pattern, right? But also it is giving a directional information, that what is the direction of the flow. But when we apply the power Doppler, as we can see in the second image, it is not giving us a red and blue color, but it is sensitive to low flow. It is giving a very specific light yellow color. So that is very sensitive to low flow. So whenever we want to know this is not picking up the color on the color Dopplers, then we can apply the power Doppler and see that whether the velocity of the flow is less, that is why we are not getting the flow, or actually the organ is not getting that vascular supply. So coming to the pulse wave Doppler, that is the when we give the spectral waveform. So that is the pulse wave Doppler, which is depth specific, and it is subject to aliasing also. So it is to assess the blood flow within the blood vessels by measuring the velocity. When we want to measure the peak systolic velocity, the pulsatility index, resistive index, so that we know whether there is actual stenosis, we want to diagnose something, and using the Doppler effect. So then we use the pulse wave Doppler. So then coming to the continuous wave Doppler, which does not give any depth information, but it is used in high velocity flows. For example, in cardiac imaging, basically it is used in cardiac imaging only because it allows the measurement of the blood flow velocity along the entire ultrasound beam, and particularly it is useful for the high velocity flows. So the basic difference in pulse wave and continuous wave Doppler is that the continuous wave Doppler, it sends and analyzes the sound wave in a single stroke, like it is sending and it is analyzing in a single beam. But the pulse wave Doppler is sending the ultrasound beam and the sound wave, but it does not have any depth limitation. So it lacks the ability to pinpoint the exact location of that flow. So it is sending in one go and then analyzing in the other beam. So continuous wave Doppler, they utilize the two crystals in the ultrasound probe, and one is continuously transmitting the ultrasound wave and the other is continuously receiving the ultrasound beam. So we have a Doppler shift equation, which we can memorize with this formula, that is 2 into velocity of the blood into transducer frequency into cos theta divided by the propagation of sound. So theta is the angle of insonation. So angle of incidence between the ultrasound beam and the direction of flow. So in the diagram, we can see that cos theta, we know that if it is 0 degree, that is if we keep the probe or the angle of insonation in the line of the blood flow, in the direction of the blood flow, that will provide the maximum Doppler shift, because cos 0 is equal to cos theta, when the angle is 0, it is equal to 1. So that will provide the maximum Doppler shift. But if we keep the direction of the ultrasound probe, or the angle of insonation will be 90 degree, that will be perpendicular to the flow, the direction of the blood flow, then that will be, there will be no Doppler shift, because cos 90 degrees is equal to 0. So this whole formula will become 0. So there will be no Doppler shift in that. The small pressure changes from the reflection that return to the transducer distort the crystal element, and that stimulates the transducer. So the distortion, it once again, it generates the electrical pulse, and that can be processed into the image. So just about the basic terms that we use in ultrasound. When we use the term anechoic, that means anything which is clearly black, that is, it is not providing any internal echoes, it is not emitting any echoes. For example, the fluid, the serous fluid, the blood, the urine, so all the gallbladder, urinary bladder will appear black, that is anechoic. When we talk about hyperechoic, which is bright, so any specific structure which is giving more echoes will be brighter to that of the surrounding structure, that is called as hyperechoic. So anything which gives off more echoes will be giving that whiter appearance, so that is called as hyperechoic. Then hypoechoic is when the structure gives off few echoes than the as compared to the surrounding structure, so that will be darker as compared to the surrounding structures. And isoechoic, when the structure gives off similar echoes related to that of the structure on the ultrasound, so it will be shown as a similar to that of the surrounding adjacent tissue. So thank you for your attention.
Out they can ask.
Oh, hello, ma'am. Hello.
Yes.
Excuse me, ma'am. Can you share the PDF, ma'am?
Yes, I think
I will share you with sir.
Okay, okay. Thank you so much.
I think there is no more doubts, ma'am. So we can quit the class here. Thank you, ma'am.
Okay, thank you.